Hello everyone, welcome back to another edition of the Lynn Lowdown. I'm David Torrey, and today we welcome back on the Lynn Public Health Department to speak about another department. Thank you so much for coming on today.
Thank you for having us.
Great, so would you mind just quickly introducing yourselves for the audience? Let them know who you are.
Lisa Tobin, Public Health Director for the City of Lynn.
And Erini Kamarinos, Epidemiologist.
Right. So today we're here to talk about West Nile virus, mosquitoes. I swear we will get you on for a topic that's not pests one of these days. We'll get there.
Whatever the public needs, Danny, whatever the public needs.
Well, I appreciate it. So I will admit I had to Google a couple of the words you used, so we may just go over them real quick for the audience. But you're talking about I don't know how to say this.
Arbovirus.
Thank you. What is that?
Oh, I will go. So it's a virus that is transmitted by the bite of a mosquito usually. And one of the examples is West Nile.
Okay, so it's the fancy scientific way of saying disease transmitted through infected mosquitoes, as far as other things. So on this specifically, it is about the West Nile virus, and why is that what you've chosen to specifically focus on?
Well, in September, we generally find that that's when any cases of West Nile virus may occur. We were recently notified by Mass Department of Public Health that we did have one positive mosquito sampled with West Nile virus for the 2025 season, as well as last year. And as a result of that, our requirements are to notify the public. And Erini takes care of the disease surveillance through the Arbovirus dashboard and our notifications.
Yes. So you're mentioning you coordinate with the state. That's how it works. They do some of the testing, report back to you, and so you have access to a whole database.
Correct, yes. So once we get the notification from the State Department of Public Health, we initiate a response, which includes a press release. And also the public has access to that dashboard for EEE and West Nile virus. We can filter it by city and county, and we have those resources linked on our webpage.
Oh wow! So that's good to know that the public has access to it as well.
Oh, absolutely.
Yes.
And it's you figure it's one mosquito out of thousands, but there's the one, so you got to do it.
And one of the things I think that worries people is when you look at those dashboards, it will say Lynn's risk is moderate, and it's moderate out of low, moderate, high, or critical.
Okay,
so it's a little bit more nuanced than just hearing the word moderate, and we don't even have any human cases. We just have one mosquito. So yeah.
Oh, so you answered my question. Say, was there any reported in humans?
Right.
So no.
But seeing as we are a community with a lot of bodies of water and Lynn Woods, it's important to make sure that people know that we have at least that one mosquito that was tested positive, and to be sure that the public knows what to do to prepare. And it's the same thing we all know. Insect repellent, long sleeves. Be mindful when you're out after dusk. When the mosquitoes tend to be out, get rid of any standing water. Don't leave the kiddie pool just sitting out there full.
Repairing screens in homes.
Oh yeah,
yes.
that's it too.
Yeah, so they don't fly in.
Yeah, so if you're inside, they don't get in.
Right.
Yeah.
And it's a little different for us because we are, like you said, we're on the water, so sometimes we can get a little bit more of that breeze, but they're still out there. You can definitely tell. That's always our mark, is if we're going to eat dinner outside. Are they out there?
Yes.
It's dusk, no.
Yeah. And we do have a lot of green space in Lynn. We have a lot of park space. We have the woods. We have the ponds. We have the cemetery. So it is something that we should be mindful of. Essex County in itself is low. There are 5 communities within Essex County that have been moved to moderate, and most of them are because of one sample.
Okay.
Yeah.
So that was one of my questions too, is how do you notify people without making them, panic at all? Yeah, basically without making people think, oh, this is, it's something they're aware of, but it's not, like you said, it's not critical.
Yes. So we definitely want to highlight the press release that we update on based on what we have in Lynn, so the cases in Lynn.
Yeah.
We upload that on our social media pages, our website. We try to promulgate it to the appropriate parties within the city, animal control officer, inspectional services. We want to make everyone aware and to follow these tips. And then, of course, if we had human cases, it would escalate the response. But as of right now, it's just the one positive mosquito sample.
We really want to encourage people to go to our website because we do try to make a lot of information, on-time, real-time information available to the public. We have the Arbovirus dashboard that you can click on any day to see if that's changed. If you're going out to Western Mass and you want to see what's going on in Western Mass, you can pick Western Mass. You can pick any community in all of Massachusetts and see what's going on. And that's under our summer resources, where we also have things like sunscreen and what's the air quality today. So we try to make sure that we notify people, but that they have access to getting information even when we're not available in the office. So we put all that stuff out there for folks.
Access 24/7 if they ever need it, if they ever want it. It's really the transparency of it, right?
Yep.
Yes, absolutely.
I'll ask the epidemiologist. West Nile virus, you hear about it, but what is it? Could you explain it a little bit? Kind of what can happen if a human were to get it? So
the degree of how people are affected varies. So some people experience mild symptoms, some people experience more severe symptoms. A lot of people describe it as flu-like symptoms.
Okay.
And then, of course, a lab result will confirm it. And then we, as the FBI, call to follow up with the provider and then the patient to see where the person may have been infected. It's not always easy to pinpoint the exact source because people tend to travel, especially during the summer months.
Right, yeah.
But we do our best for surveillance and to follow up as thoroughly as possible.
Is that one of those cases where people who are older could potentially be at higher risk? Is this one of those diseases that follows that pattern or not really?
Potentially, yes. With age, a lot of times viruses are exacerbated.
Yeah.
But overall, the recommendations are to follow the tips. Of course, it's not easy to wear long sleeves in the summer, but that's just one of the many tips that we recommend through the Department of Public Health on the state level.
Yeah, and Mass DPH, their notifications that 80% of the people who actually are diagnosed with West Nile virus have no symptoms.
Right.
And
wow.
Yeah, and 20% have, anywhere from fever, headache, body aches, nausea, vomiting, swollen lymph glands. So, I don't know how many times you've been bit by a mosquito, and maybe you feel good, maybe you don't. But to Erini's point, if you are someone who is immunocompromised, if you're someone with other health conditions, and you are bit by a positive mosquito, you could be of the 20% who get the symptoms.
Right.
But
Yeah.
So I wanted to check with the experts on that one. I know that can be a common thing, but I wanted to make sure. And is that you were mentioning all the tips that people can do. Another thing is if they have any standing water. You mentioned there's standing water in Lynn just in general because we have ponds, but if there's any in people's backyards to get rid of it because that is where mosquitoes breed.
yeah, one of the things that we find tends to be an issue are tires. People keep tires out in their yard. The water collects in the rim of the tires, and it's a great breeding ground for mosquitoes. So making sure that if you do happen to have tires out, you're emptying them of water, you're getting them away from the rain and stuff like that is really important.
I had not thought of that one. I was thinking more if you had little, basins or something.
Yep.
I did not think
Yep.
of tires.
That too.
That's good to know.
Yeah.
Maybe some lawn toys. I know sometimes people have for their kids water tables
Yep.
in small pools, so that's also another source that,
Yeah.
So, say prevention, keeping yourself safe is a big thing you want to tell the public.
Absolutely.
And they're simple.
Yeah, and I feel like most people, they don't want mosquito bites even if it has West Nile or not, right?
Right.
So you kind of know what to do to prevent the mosquito bites to start with. And you can wear repellent so you won't get bit, but you should also do the things that prevent the mosquitoes from being there in the first place,
Right.
which is removing the standing water, repairing your screens. Yep.
And you're saying, and there was one positive mosquito this year, and there was one positive last year?
Yes.
No human cases?
No
That's
human
correct?
cases, yes.
Okay.
Yeah.
Wanted to just
Yeah.
double check the
Yeah.
stats on that.
Yeah, yeah. West Nile virus, you hear it and you think, oh my gosh. And there's a release from the public health department about it, and you feel like it's something that you should be concerned about.
Yeah.
Not saying you shouldn't be concerned, but we try, again, very strongly to make sure that people understand exactly what is happening, being transparent, putting that dashboard so people can look for themselves, feel like they understand it.
Because having the understanding and the information it's vital to
Right.
having the reaction, right?
right.
It's key. It's key.
And you said they can just access it on your website. Is it a specific page or anything? Or you just go to the...
So if you go to the City of Lynn's website and you go to City Government, you will pick Public Health, and we have a Resources tab and then a Summer Resources tab.
Oh.
There's a lot of information on that page.
Yeah, I can imagine. I've looked at it before. It's very
Yes.
impressive. It's very informative.
Thank you, thank you, thank you.
And it's simple to understand too. Like, people can figure it out. Go on and look at it. And as for mosquitoes, how long do they typically stay around? Because as we get into the cooler months, they may start to not be around.
September is peak month for mosquitoes, and then as you said, the temperature drops, first frost and things like that. We usually tend to not see cases during the winter months.
Okay, so
First frost.
Right.
so like fall is really is their ideal time. That's where they go.
Yeah.
Well, summer too, but
Yeah.
And the fall tends to be the time when people may be coming out of the house more because it's cooler out. You're opening your windows because your AC isn't on, so it's also a time that you will see more people may be bitten.
Yeah, right. That all makes
Yeah.
So yeah, I think we've gone over most of the points that I did, but was there anything else that you wanted to make sure people knew about, whether prevention information, anything like that?
I guess just being mindful, following the tips. We definitely don't want to hinder anyone's summer months and summer fun, but yeah, just being informed, keeping up to date with the dashboard, our website, things like that.
Yeah, I would just always encourage people to check out our website, come into our resource room, room 105 at Lynn City Hall. We always have resources and things available for people. We can print information up if people aren't comfortable navigating the website. So, we're always trying to give out the information to folks so that they have what they need.
You've always been very forward-facing. I see you literally all the time. So I want to thank you again for coming on to really talk about this, inform the public, and all of that.
Thank you for having us.
Thank you. It was a great time.
Of course, always. And like I said, we'll see if we can get you on next time with something that isn't
Okay.
best. We'll see.
I'll find something
try it.
juicy for you, yes.
But for now, I'm Danny Vittori. This has been the Lynn Lowdown, and we'll see you next week with more guests.